PeraHealth partners with hospitals and healthcare systems in a number of ways to help improve the lives of patients. We do this through the use of our Rothman Index, which gathers data directly from the electronic health record to help inform clinicians in their decision making, as well as help impact decision making for patients and their families. Through the use of the technology, we're able to give a glimpse into true patient condition. This can be whether there's deterioration taking place or whether there's actually improvement in the patient's condition overall. Furthermore, we're able to help an organization make decisions around care management, ICU optimization, bed placement, as well as perhaps even whether a patient should be considered for palliative care consults. We do this in a very joint and collaborative way with organizations through the prioritization of use cases for the technology. We support in the implementation and rollout of the various use cases through the delivery of training, education, and delivery of evidence-based playbooks. As a nurse, I have firsthand experience in what it's like to take care of a patient at the bedside and to recognize or have a feeling that something isn't quite right. I would have loved to have had the PeraHealth technology available to me when I was caring for patients. What I see now is that so many things that I was documenting maybe we're not seen as being relevant because it may have just been something like the patient seems more confused. The patient has now decided that they don't want to eat. The patient is having a little bit of numbness in one leg and no longer wants to stand. But I was often met with, well, what are the vital signs and what are the current lab values? I think if I would have had something like the Rothman Index, I would have been able to quickly point to what was happening with the patient's change in condition and would have had a language that I could have used with physicians or other care providers to have helped make decisions. Furthermore, it would have given me a great glimpse into what had been happening to that patient in the 12 hours before I came on shift, the days that that patient had been in the hospital. Because of the graphical depiction provided by the Rothman Index, it's a very easy way to see how a patient's course has changed during their hospital stay. As I mentioned earlier, you're also able to see prior visits, so you can get a really good glimpse with the click of a mouse as to how a patient's condition has changed over numerous visits. We even have organizations that use our technology because of the simplicity of the graphs and how easy it is to pick up on what those graphs are actually telling you, to use those to have very complex conversations with families. As clinical folks, we are all very well versed in clinical terminology, but common patients or patients and their families are not generally well versed in some of those terms, and using something like the Rothman Index graph is a great way to be able to explain what is going on with a loved one's condition.